it is my responsibility to follow safe practices for my safety and the safety of my coworkers, patients, and visitors to our hospitals.
Good morning for those of you who don't know me, and I don't see anyone here that I don't know. Met a new face today, though. My name is Peggy Hatton. I'm part of the safety department. You know the rest of us. Kathy Phillips. There's Rick Luna. And I'm not sure where Elizabeth went, but she's here as well. Kathy will be doing infection control today by doing Who Wants to Be a Millionaire? Anybody? Excellent. And then back here with Lisa and Jenny, we will be doing The Amazing Race, which is all about body mechanics, which we all need, right? And then back in the corner will be Celebrity Apprentice with Rick Luna. That will be about hazards and how to fix them. Okay? Any questions so far? Are we good? This year, as we have done in other years, the reasons for the lays is so that I keep thinking I have one on. So that you know which area you will start in. We will go counterclockwise, but the instructors will help you. All right? As we have done in the past, when you're all done, you'll come back to your chairs, and on your chair will be an evaluation, which A, is not mandatory and does not require a signature, completely anonymous, but we really want you to do it because we want to know, did you have a great time? Did you learn something? Is there something else you would like to learn about? And then, of course, there is the test, which is mandatory, and there is a place for your name on it. So please make sure that you do both sheets of paper. And then, of course, when you turn them in, we'll give you your certificates. Okay? Rick, is there a problem?
What?
Is there a problem?
Oh, besides the fact that I have to sign people in, and that somebody was supposed to be doing that, and that everyone else is doing one station and I have to do two.
Everyone's doing their part, Rick.
No, I'm sorry, folks. You asked. We talked about this
not
2
now.
months ago.
Rick, not now.
2 months ago. You're not my mom, and you don't tell me what to do. You're not my boss.
Rick.
No, listen. I'm talking to Peggy right now. Yes. Richard, she's...
Not the time, not the place.
Listen,
I will listen, but not here. Come here.
Acting! Oh!
I had such a hard time going, it's okay, everything is okay. Because I could hear people going, oh, what's happened to Rick? Rick has lost his mind. And y'all know Rick would never talk to me like that or anyone else because he'd know I'd take care of him. And he always comes up and apologizes afterwards.
Is that a workplace violence threat?
That is a workplace violence threat. Holy smokes. All right, thank you guys, and they're going to continue.
Good morning. My name is Richard Sanders. I'm the head of security. I know quite a few of you. Those that I don't know, nice to meet you. What we're going to talk about today is de-escalation. We're going to talk a little bit about workplace violence. First and foremost, with one exception, there's really only two reasons people come to a hospital. The one exception is labor and delivery. That's the happy time, right? Hey, we're having a baby, we're happy. Other than that, people come to a hospital because they are sick or dying, or someone they know, care about, love is sick or dying. Pretty much, right? Right. Which generally puts people already in a bad place. So they're already emotionally elevated by the time we get to interact with them. That in and of itself makes de-escalation very important because they're already escalated. As we did that skit, one of the things you noticed, I have a pretty loud voice, just generally. What did I do with my voice?
You calmed it down.
Lowered it down, exactly. Who here, by a show of hands, has never been in an argument in their life with anybody? Really? We've all had arguments at some point in our life. What happens to your voice in an argument? Goes up. The other person goes up, goes up, goes up. By that point, nobody hears anybody, right? But when you lower your voice, what do you actually have to do to hear what I'm saying?
Listen.
You actually have to listen. Have you been through this before? No. All the right answers. All the right answers. You actually have to pay attention and listen to what the person is saying. And the other piece of that, and this works because I see it with my teenagers all the time, if I lower my voice, and I'm still yelling up here, after a couple of seconds of that, you feel pretty silly. I mean, think about that. If you're arguing with somebody and all of a sudden they're talking in a normal voice like this, and you're still yelling, you're going to feel a little dumb. And it works. Trust me, it works. We see it every day in the EDs. We see it throughout the hospital. And again, this is a tool that you can use in your personal life as well. What's one of the other things I did with Rick? Peggy's over here. Rick is here. He's mad at her. Did you see what I did with Rick's positioning? I turned him so that he had to look at me instead of looking at the object that has him upset. Whether that's a person, a thing, whatever it is. There's an old saying, out of sight, out of mind, right? It's very true. Get him to turn his focus away from what initially has him upset, and it's going to help to de-escalate that. And then try to get him completely out of the area to find out what the issue is, pursue it further. Excuse me. One of the other very important pieces of this is how you, if you're having to de-escalate a person, if you're in a position to where you're having to deal with somebody who's escalated. Positioning is very important. You don't want to get yourself what's called cornered. You don't want to be in a room where you're over here in the corner, the door is over here, and you've got an upset person between you and the door. You always want to keep yourself an easy avenue to get out. These are all tools that we give you guys to help you understand how to de-escalate a problem, how to best work with an issue. And the fourth one is we're a team, right? We need to work together as a team. If you have a patient, a family member, a visitor who, for whatever reason, focuses on you, you are the reason everything is going wrong. You may have nothing to do with it. You just happen to be there. What should we do in that case?
Remove me from the situation.
Disengage, exactly. She's nailing them. You disengage from that environment. You get out. Get somebody from your team to come in. Then they become the hero in that sense. They have now gotten rid of you for being the problem, whatever it was. Then they're going to help that person to resolve their issue. Work as a team. Teamwork is probably one of the most important pieces of that whole puzzle. You have to work together. You have to be able to call your supervisor. You have to be able to call your teammates and say, I need you to come assist with this. You disengage from it. Obviously, if you have a person who's escalating like that, not only do you want to get your team involved, you want to get us involved, right? Okay. As we all know, we work together a lot, right? At least 40 hours a week, pretty much, we're all together. It's a big part of our lives. In a sense, it's very much like a family in how much time we spend together, right? And as we all know, we never argue, disagree, or have problems with family. Right. They're the people we get along with the best, right?
Right.
Now, one of the things that we want everybody to be comfortable and to understand is that workplace violence has a zero tolerance. I mean, we hear that a lot today. There's a lot of talk about workplace violence, and you guys, this is a tool that you have to help de-escalate situations before they get there. Now, workplace violence doesn't have to be getting punched. Threats are a common one that we hear about. Now, if I had a nickel for every time I probably got threatened, I'd maybe have a quarter. Now, I take threats very differently than somebody else may. What somebody says to you may be taken very differently than how you would take it. Something that you say may be taken completely different. And we have to be conscious and aware of what we say and how we say it. because one person may take something as a threat that another may not. And it's very important that if you feel threatened, you feel comfortable in reporting that. Now, there are other ways to report those other than just your supervisor, but it is very important to use your supervisor, your chain of command. But if an issue doesn't get resolved, you have security, you have safety, you have human resources. That's a tool for you to go and say, this person made a threat, I don't feel safe, I don't feel secure. That's what we're here for.
When trying to de-escalate a situation, use a calm voice and get help if needed. Code Gray is a person exhibiting assaultive behavior. Code Silver is a person brandishing a weapon or holding a person hostage. In the event of a Code Silver, you should seek cover or protection and warn others. Dial 611 at Alta Bates or Harrick Campus, or 5555 at the Summit Campus to report.